I'm Dr. Marcy Riches, the Clinical Medical Director for the Adult Bone Marrow Transplant Program, the North Carolina Cancer Hospital and UNC Health. The COVID-19 pandemic has impacted all of us in our daily lives. This includes in how we are able to provide cancer care. The Cancer Hospital has made several changes in order to ensure that we are able to provide our transplant and cellular therapy patients the highest quality and safest medical care we can provide.
And this includes the care and treatment of our youngest patients. At the North Carolina Cancer Hospital and the UNC Children's Hospital, we are dedicated to providing a safe and nurturing environment to our pediatric patients and their caregivers.
Our commitment to keeping you and our staff safe begins with changes in policies and procedures throughout the hospital and in our bone marrow transplant clinic. We've provided self-checking kiosks for registration. We've added extra hand cleaning stations. We have set up a dedicated elevator for use only by our BMT and cellular therapy patients. We require patients to wear a BMT-issued mask in exam rooms. And we have modified our visitor policies to keep our patients safe while also recognizing the importance of keeping them and their families connected. These changes allow us to continue to provide cancer care safely in and around our clinics.
Similar to our adult transplant patients, we are also committed to keeping our pediatric patients, caregivers, and staff safe. Patients being seen in the pediatric clinic may have a caregiver with them throughout the visit. However, siblings are currently not allowed in clinic. Our pediatric oncology clinic has modified its scheduling template to reduce the number of patients in clinic at one time, and the chairs in our dedicated waiting room have been spaced apart to promote social distancing.
The check-in procedure for your advanced practice provider will mirror the same process and procedure for your physician visit. The advanced practice provider group continues to offer routine follow-up visits as well as procedure visits. There are a select group of visits that we are able to offer virtually. If you have any questions about your upcoming appointment, please contact your cancer care provider.
UNC Lineberger Comprehensive Cancer Center remains committed to advancing cancer care through research. This includes performing clinical trials. And just as we've created approaches that help us more safely care for our patients in the clinic, we're using these same approaches for our patients participating in clinical trials using techniques such as telehealth and virtual visits. We remain focused on developing and testing new cancer treatments that we can bring to our patients so we can care for them better in the future, and we're doing so in a way that safeguards their health and well-being now.
Having a cancer diagnosis can be challenging even in the best of times. Though we do not know what the pandemic might bring, we are here for you, your families, and your caregivers, and we are committed to providing the best and most advanced cancer care in the safest possible manner.